I was part of the Haitian relief team that went to the DR from Creighton University, and basically our mission was to assist in the Dominican response to the Haitian earthquake survivors, and we were based out of the ILAC Institute, or ILAC Center, which is a Creighton sponsored institution there, which does some medical relief work. We were in Haiti, the Dominican Republic. We recognized that's not Port-au-Prince, but it's about 30 miles away. Our team was pictured here at the ILAC Center, a couple surgeons, a few nurse anesthetists, a pediatrician, an orthopedic PA, scrub tech OR nurse, and of course Father Bill Johnson. The first scene that we saw when we got there was a lot of coffins and some bottles of water, which highlighted the two immediate needs when we got out there. The hospital was like this, patients being loaded up into pickup trucks, brought up to the front of the hospital. This is the hospital building from a distance. This is the chapel, which is converted to an inpatient unit as well. And this is an orphanage that was down the street. You can see a very beautiful scenario there with a lot of mountains and a lake and everything. You know, outside from the disaster, it's a beautiful, beautiful spot, and you can understand why a lot of people vacation in DR. This is a scene here of some patients. You see bodies, patients littered across the floor. We had a lot of transport in, made for some fairly dramatic scenes of helicopters coming in and out and ferrying patients both to and away from us. There's a cross that was pitched out in front of one of the helicopter landing pads. Things began to get organized. We had an OR slate, but then things quickly fell apart again as an aftershock hit, and all the patients moved out of the buildings for fear of their lives and set up tents outside in front of the buildings. And people even jumping off the second floor of this building because they're so scared when the aftershocks hit. This is one of our patients. The Haitians are just amazing people. You know, 2 broken ankles, and here he is sweeping the floor trying to keep the place clean. Kids, just wonderful kids, just becoming just more and more as days went on. They became more and more like regular children, playing soccer out in the fields. A few things I learned there. Going out there, most important thing, set aside your ego, be flexible, do what you need to do. Communication, organization are of utmost importance. That medieval healthcare or medieval type healthcare without organization leads to medieval type complications and mortalities. And then finally, that needs are constantly in flux. That what became initial acute orthopedic trauma gradually became more chronic needs such as physiotherapy and rehab, and that things you wouldn't think you'd need in a relief situation such as pharmacists and x-ray technicians actually became a need as time went on. And that's it.